Welcome to Ask the Oncologist. In this video, I'll be talking about the signs and symptoms that you can look out for when it comes to prostate cancer. Now, the first thing is that most of the prostate cancers are diagnosed at the stage where they are silent. Silent in that the individual doesn't have any signs and symptoms. And at these stages, the disease is usually diagnosed very early and it has better outcomes. What it means is that instead of waiting to start noticing some signs and symptoms before you go to the hospital, you should take up a very proactive method where you do a screening regularly, especially for men who are above the age of 50 years. Because early diagnosis in these stages saves lives, saves you a lot of treatment, and it gives you better outcomes at the end of the day, even if you have to go through treatment. Now, for most of the other people that we see, they usually present with certain signs and symptoms. One of the commonest signs and symptoms we see is what we call the urinary tract or lower urinary tract symptoms. Now, if you look at this picture over here, you realize that the prostate gland, as I mentioned earlier on, lies just below the urinary bladder. And also, when urine flows from the bladder, before it goes out through the penis, it flows through a part of the urethra that we call the prostatic urethra. The prostatic urethra lies right in the middle of the prostate gland, which means that before urine can exit the body, it has to pass through the prostate. Now, mostly when there is cancer development in the prostate, it tends to increase the size of the prostate gland. What this means is that as the prostate gland enlarges, it can also compress on the urethra, which lies right in the middle of the prostate gland. This will often impede on the flow of urine, and then it will give the man certain signs and symptoms. One of these lower urinary tract symptoms is what we call nocturia. Nocturia means the man wakes up several times in the night to urinate. In fact, it's normal to wake up about 2 or 3 times to urinate before daybreak. However, when we say somebody has nocturia, they often wake up more than they usually did in the past. In fact, we've had people who have to wake up about 10 times to urinate before daybreak. And often, the urine comes in bits instead of the usual flow that they have. This is often something that you want to check up with your healthcare provider and get screened for prostate cancer on. Another common sign and symptom we notice when it comes to the lower urinary tract symptoms includes what we call hesitancy. Hesitancy is when somebody goes to the washroom, they feel like they want to urinate, but then when they approach the washroom and get to the place, the urine doesn't want to come out. They often stand there and the urine hesitates to flow. This is what we call hesitancy. They may often spend some time standing in the washroom before the urine finally comes out. This is something that you obviously need to check up with your healthcare provider on. Another is frequency. Frequency just means that you urinate more frequently than you did in the past. Because of the fact that the prostate gland allows the flow of urine, when it's enlarged, it tends to impede the flow of urine. So the man has to visit the washroom very frequently because they are unable to empty their bladder each time they visit the washroom. So this is also a very common sign and symptom that you should be looking out for. Now, when the disease progresses, it can infiltrate the urethra that lies right in the middle of the prostate. When this happens, there can be bleeding from the cancer cells into the urethra. And now, when urine is passing through the urethra, it's often accompanied by blood, and then the individual may see that there is blood in their urine. It may not only be because it is from the prostate gland, but it could also be as a result of diseases that are coming from the bladder and then higher up, even from the kidneys. So anytime you notice that there's blood in your urine as a man, you need to follow up on it and get it investigated so that you are sure that it is nothing that you need to do something about. Another common sign and symptom may be problems with erection. You can term it erectile dysfunction. Now, around the prostate gland, we have nerves that control the erection of a man, and these nerves are located on either side of the prostate. When the prostate cancer advances, these cancer cells can infiltrate into these nerves that are surrounding the prostate. And when these nerves are infiltrated, it impacts or it affects the ability of the man to be able to have or sustain an erection. So when you notice sudden changes in your erectile function, it may be something that you need to check up on. It may not necessarily be related to the prostate gland, but it's obviously something that you need to find out what may be the cause. Now, as the prostate cancer goes undetected for longer periods, it begins to spread outside of the prostate and further away. One of the common locations that prostate cancer will often spread to is the bones, and commonly the bones that are located around the pelvis. Most of the patients that I see will usually present to the hospital for the first time because they begin to have some pain in the bones, either in the pelvic region, the lower back, or they may have pain in the hip. And then often they will realize that it's as a result of the cancer cells spreading to these locations. So when you begin to have unusual pain or you begin to have sudden onset of lower back pain, it's obviously something that you need to check up on to be sure that you are not dealing with any prostate cancer. In addition to the pain, we have often seen patients who present to the hospital for the first time with prostate cancer because they realize that they could not walk all of a sudden. The unfortunate thing is that most of these patients get admitted in hospital further away and managed as people who have stroke. Some of them even end up spending weeks and months at prayer camps and with herbalists trying to get treatment. They are often mistaken to be people who have developed stroke. Unfortunately, they usually turn up at the hospital when it's been so long and things have gotten so worse and have gotten irreversible. So when you notice that somebody all of a sudden cannot move their legs, their two lower limbs, it's something that must be checked up in the hospital. Before you conclude that it's a stroke, make sure that it's not as a result of prostate cancer compressing on their spinal cord. I hope that having heard me talk about these signs and symptoms, you will be on the lookout for them. If you notice anything unusual about your body, don't forget to visit the hospital and get it checked up. And remember that early diagnosis saves lives. Early diagnosis also saves you a lot of treatment. Early diagnosis also means that you get to have lesser morbidities after your treatment for prostate cancer. Early diagnosis also means that you save yourself a lot of money and you live longer to be able to enjoy your life with your family and relatives. Thank you very much. If you like this video, don't forget to share, comment, and like the video as well. Let other friends and family members get to know about this video so that they can learn and be impacted. Thank you very much for making time with us. See you in my next video.